So doctor, talk to me about the liver. We've talked about that a bunch of times, but I know it's so important. What are some of the things that you've seen in your practice?
Well, you know, I've been practicing since 1978. And 40 years ago, when people came into our office, the last thing I ever thought about was how their liver looked. And you can tell my little friend right here, in the human body, the liver just gently lodges right into here. And the blood flows through the bottom of the body, up through the liver, on the way to the heart. Well, because of technology, digital x-ray, we take our postural films standing. So when someone is standing, that liver is dropping down, and we're seeing livers that literally go into a person's abdomen. See, the liver should stop right here about the lower part of the ribs. So we're seeing individuals, and I have this wonderful prop here, this is a pelvis. We're seeing individuals where their liver is actually coming down into their pelvis. And what that does to someone, Scott, if I turn this around, that'll literally cause their pelvis to shift. What I'm going to share with you next is a secret. You know, I passed a lot of secrets on to you over the last 4 or 5 years. Someone can have chronic low back pain because of a fatty liver and their pelvis moves. It is possible, as far-fetched as this is, that somebody could have back surgery, have a failed back syndrome because they have a fatty liver. Now, what I'm going to share with you next is going to blow the minds of people around the world. Are you ready? Fruit can cause a fatty liver. And I know that people read popular magazines, say, Dr. Bob, I have a fruit smoothie every day. Dr. Bob, I have this every day. Well, because of our technology and we do diet sheets on individuals, I am telling you from my experience, people who do smoothies, people who do a lot of juicing, it places a demand on their liver because fruit is fructose. Your liver has to process it. So whoever's watching us anywhere in the world right now, if they're having chronic health problems and if they love fruit, because people do love fruit, and I usually suggest to them, you know, switch over to some vegetables, carrots, celery, radishes, cauliflower. That's what I eat on a regular basis. So I have another model. Don't you just love technology today with what we can do? So this is a normal liver. This is an example of a fatty liver, and here's the gallbladder. So the gallbladder is your reservoir of bile. Bile is your body's dish detergent. Your liver makes the dish detergent, and it's stored in the dish detergent bottle. So cool, isn't it? So when they take your gallbladder out, they're taking your dish detergent out. So I know that if you ever cook chicken at home and you go to wash your hands, if you have even warm water, the grease doesn't go away, but you add your favorite dish detergent and guess what happens to the fat? It emulsifies. The liver is a key organ, and I'll give you a couple examples of why somebody may have or know they have liver dysfunction. They'll have varicose veins, spider veins, hemorrhoids, and they could start having little red bumps in their body called cherry hemangiomas. Women will have tender breasts and heavy menses. Men could have an enlarged prostate. Body signals for compromised gallbladder usually would be metal taste in the mouth, queasiness, bloating after 2 or 3 hours after having a meal. But to me, almost a pathognomonic, that means like really specific for liver gallbladder distress, is certain foods that create distress. Green peppers, onions, but it's the radish. I love radishes. I eat 2 radishes every day. Radishes are bitter herbs, and what bitter herbs do, they place a demand on the digestive system. So who's ever watching us right now, if they have digestive distress with radishes, Dr. Bob just answered their question. Pretty amazing, isn't it?
Hi, and thanks for watching this video. If you like that video and you like our channel, the best thing you can do is support us with a Patreon donation. You can find the link here on the right. Also, subscribe to our YouTube channel. Again, that link here on the right. While you're at it, be sure to check out some of our more recent videos as well. You can find those right below. Thanks again for watching.